Vital signs. Welcome to the Nascent Procedure and Interview Preparation channel. When vital signs are taken and what is measured? What vital signs indicate infection? Which are the WHO vital signs? Which vital signs are abnormal? Can vital signs indicate pain? Vital signs are the critical aspects of patient assessment. They provide essential information about a patient's overall health status and can indicate the presence of acute condition or chronic illness. This tutorial will cover the key vital signs health worker monitor, including temperature, pulse, respiration rate, blood pressure, and oxygen saturation. First one, temperature. Normal range is 36.1 degrees Celsius to 37.2 degrees Celsius. Sites to measures are oral, rectal, axillary, tympanic, and temporal artery. Equipments, thermometer. Procedures are oral, axillary, and tympanic. Abnormal findings of fever is above 37.5 degrees Celsius and hypothermia is below 35 degrees Celsius. Second one, pulse. Normal range is 60 to 100 beats per minute for adults. Sites to measures are radial, carotid, brachial, and apical. Procedures are for radial pulse, place two fingers on the inner wrist and count the beats of 30 seconds, then multiply by 2. For apical pulse, use a stethoscope to listen over the heart. For assessing pulse, look for rhythm and strength. Abnormal findings for tachycardia is above 100 beats per minute. For bradycardia, it is below 60 beats per minute. Third one, respiration rate. Normal range is 12 to 20 breaths per minute for adults. Procedures are observe the patient chest rise and fall, count breaths for 30 seconds, and multiply by 2. Ensure the patient is unaware you are measuring their breathing to avoid altered patterns. Abnormal findings. Tachypnea, above 20 breaths per minute. Bradypnea, below 12 breaths per minute. Dyspnea, difficulty breathing, may require immediate interventions. Fourth one, blood pressure. Normal range for systolic is 90 to 120 mm of Hg, diastolic 60 to 80 mm of Hg. Equipments are sphygmomanometers and stethoscope. Procedures are place the cuff on the upper arm above 1 inch above the elbow, inflate the cuff to about 20 to 30 mm of Hg above the patient's usual systolic reading or to 180 mm of Hg if unknown. Slowly release air from the cuff, listening for the first and last heartbeats. Abnormal findings, hypertension 140 by 90 mm of Hg or higher, hypotension below 90 by 60 mm of Hg. Fifth one, oxygen saturation. Normal range is 95% to 100%. Equipment is pulse oximeter. Procedure is place the pulse oximeter on the patient fingertip or earlobe, ensuring it is clean and the patient hand is warm. The reading will show the percentage of oxygen in the blood. Abnormal findings, hypoxemia below 90% may require oxygen therapy or further interventions. Do vital signs indicate possible infections? If this channel gives you significant information, please subscribe and share. Several vital signs are commonly monitored to detect possible infections, especially since infection can provoke systemic responses in the body. Key indicators include body temperature, fever is often a primary sign of infection, although hypothermia can sometimes occur in severe infections. Heart rate. An elevated heart rate may sign an infection as the body works harder to fight it. Sepsis, a severe infection, often trigger an abnormally high heart rate. Respiratory rate. An increased respiratory rate can occur with infection as the body may need more oxygen or be trying to balance pH level disrupted by infection. Blood pressure. In severe infections like sepsis, blood pressure may drop, indicating a potentially life threatening situation as blood circulation becomes compromised. Additional considerations. Pain assessment is often considered the fifth vital signs. Use scales such as numeric rating scale or Womberger face pain rating scale to assess the patient pain level. Vital signs should be measured according to hospital policy or as directed by the patient condition. In conclusion, monitoring vital signs is the fundamental nursing skill that ensures patient safety and guide care decisions. Any abnormal findings should be reported to the healthcare team promptly. In our next video, we will discuss the following: WHO vital signs for pediatrics, why vital signs are called vital signs, when vital signs are taken, what vital signs should be reported immediately, can vital signs be delegated, are vital signs diagnostic tests, are vital signs objective or subjective. Thanks.